Hello friends, welcome to my YouTube channel. In last video I discussed MCQs from Katherine Anderson, first 3 MCQs. Today in this video I am going to discuss question number 4. Question number 4 is pelvic nerve supply. Pelvic splanchnic nerves are derived from the dorsal primary rami of spinal nerves S2 to S4. The inferior rectal nerve is a branch of the pudendal nerve. The rectal plexus is derived from the interior part of the inferior hypogastric plexus. The external anal sphincter is supplied by the inferior rectal nerve. The interior labial nerve is a branch of the ilioinguinal nerve. Now we should go through the explanation and then answer the questions. Pelvic splanchnic nerves, also known as nervi arigentes. These are preganglionic, presynaptic, parasympathetic nerve fibers, portion of autonomic nervous system in the pelvis. Arise from ventral primary rami of S2 to S4. The pelvic splanchnic nerves join with one another and also join ipsilateral inferior hypogastric plexus and amplify throughout the pelvis and lower abdomen. They control micturition, defecation and erection. And this is diagrammatic presentation. You can see pelvic splanchnic nerves, they arise as preganglionic, presynaptic. These are different types of plexus. You can see all the plexus are intertwined with one another. Now inferior hypogastric plexus, it is formed from fibers of sacral splanchnic nerves, pelvic splanchnic nerves, hypogastric nerves. It supplies the vista of the pelvis. The rectal plexus is a posterior division of the inferior hypogastric plexus. I added this slide because MCQs come in the exam from this topic. Hirschsprung disease, also known as aganglionic megacolon, is the congenital absence of parasympathetic ganglia within the large bowel. The resulting lack of peristalsis in the affected bowel segment causes obstruction and enlargement of the bowel proximal to the aganglionic segment. The incidence of Hirschsprung disease is approximately 1 in 5,000 live births, and treatment is resection and removal of the aganglionic portion of bowel. Now pudendal nerve, I have discussed this in detail in my previous video. Pudendal nerve gives off the inferior rectal nerves before dividing into two terminal branches. What are the terminal branches? The dorsal nerve of the penis, clitoris, or perineal nerve. This is diagrammatic presentation of pudendal nerve. It arises from S2, S3 and S4 segment. You can see after entering into the lesser sciatic foramen, it enters into the pudendal canal, showing in light green color, and gives off inferior rectal nerve and then perineal nerve, and at the end gives dorsal nerve of the penis. Now anterior labial nerve. The anterior labial nerves are branches of the ilioinguinal nerve. The nerves innervate the mons pubis and labia majus in females. The equivalent nerves in the males are the anterior scrotal nerves. This is the diagrammatic presentation. You can see anterior labial branch of ilioinguinal nerve innervating the mons pubis and labia majus. After reading the explanation, now we solve the question. Pelvic splanchnic nerves are derived from the dorsal primary rami of spinal nerves S2 to S4. It's wrong because pelvic splanchnic nerves are derived from the ventral primary rami of spinal nerves S2 to S4. The inferior rectal nerve is a branch of pudendal nerve. It's true. The rectal plexus is derived from the anterior part of the inferior hypogastric plexus. This is false because the rectal plexus is derived from the posterior part of the inferior hypogastric plexus. The external anal sphincter is supplied by the inferior rectal nerve. It's true. The anterior labial nerve is a branch of ilioinguinal nerve. This is also true. Thanks for watching, and if you like my video, please subscribe my channel and click the bell icon for more updates.